I have reviewed your request and the source material provided. Because the source, the second heart, 5 movements to restore leg circulation, focuses entirely on leg circulation, the calf muscle pump, and specific exercises for seniors, it does not contain any information regarding metformin. To remain factually accurate and strictly adhere to your provided source as requested, I have developed a script that applies the life outline style, narrative, contemplative, and focused on small daily habits, to the second heart material. This script explores the silent process of circulation and the small quiet movements that decide your future mobility. YouTube script, the second heart, restoring your body's hidden pump, 00:00 to 01:30. Visual, a quiet slow-motion shot of someone sitting in a chair looking out a window. The lighting is warm and soft. Text on screen. The quiet spiral. Narrator, we spend so much of our lives thinking that the big changes happen all at once. We think that losing our independence, the ability to walk to the park or stand in the kitchen to cook a meal, is something that simply happens one day when we get old. But the truth is much quieter than that. For many of us, our future mobility is being decided right now, in the small moments we don't even notice. It's decided while we're sitting at the kitchen table waiting for the kettle to boil, or while we're relaxing in our favorite chair in the evening. Most of us are told that if we want to stay healthy after 60, we just need to walk more. Walking is wonderful. It's a gift. But for a lot of people, walking isn't enough. You might be one of them. You might be someone who does everything right. You get your steps in. You drink your water. You even wear the compression socks your doctor gave you, and yet you still sit down at the end of the day with feet that feel like ice. You notice your ankles looking a bit like bread dough by dinner time, swollen and heavy. Today I want to talk about why that happens. I want to talk about the second heart you didn't know you had, and the 5 simple human movements that can wake it back up. 1:30 to 3:30. Visual. Simple animation showing the lower leg and the veins. Narrator. Most of us only think about one heart, the one beating in our chest, but doctors often refer to your calf muscle as your second heart. This isn't just a poetic phrase, it's a mechanical reality. Every time your calf muscle tightens, it acts as a pressure pump. It squeezes the deep veins buried in your lower leg and physically pushes your blood upward, fighting against gravity to get it back to your chest. Inside those veins are tiny one-way valves. They snap shut after every squeeze so the blood can't fall back down. But as we pass 60, this pump starts to encounter a few problems. The vein walls can become a little more stretchier. Those tiny valves might start to leak. And most importantly, if we spend a lot of our day sitting, the calf muscle itself begins to shrink and lose its power. When the pump slows down, the blood stalls. It pools at your ankles. This is where the coldness comes from. This is where the swelling starts. And it's a slow downward spiral. The less you move because your legs feel heavy, the weaker the pump gets, which makes you want to move even less. Poor circulation isn't just a small annoyance we have to live with, it's a warning sign. It's our body telling us the arteries are under strain. By age 70, nearly 1 in 5 adults has peripheral artery disease, a narrowing of the vessels, and most of them have no idea. But there is a way to cast a vote for your future. It doesn't require a gym. It doesn't even require you to stand up at first. 3:30 to 6. Visual. The narrator sitting in a simple, sturdy chair demonstrating the first movement. Narrator. Let's look at how we can flip the switch on that pump. I'm going to walk you through 5 movements, counting down to the one that vascular rehab programs rely on the most. Number 5, the ankle pump. This movement is so simple that many people skip it, thinking it couldn't possibly work. But this is the very first thing surgeons ask patients to do after leg surgery. It is designed to keep blood from sitting stagnant while the body heals. In fact, a 2025 review of 16 different trials found that simple ankle pumping improved blood flow and reduced swelling in older adults without them ever having to stand up. To do this, just sit in your chair with your feet flat. Lift your toes up toward your shins while keeping your heels down. Then reverse it, press your toes down like you're pushing a gas pedal and lift your heels. The key here is the life outline way, slow and deliberate. Do 20 to 30 of these while you're watching the news or reading. It costs you nothing, but it wakes the system up. 6 o'clock to 9 o'clock. Visual. Narrator demonstrating the seated leg lift. Narrator. Once the system is awake, we need to move higher up the leg. Number 4, the seated leg lift. When you straighten your leg out in front of you and hold it, you aren't just exercising, you are firing the large muscles in your thigh and hip. the ones you rely on to stand up from a chair or climb stairs. When these muscles contract, they press on the large veins in your upper leg, driving blood further up toward your heart. Geriatric doctors track something called gait speed, how fast you walk. They call it the sixth vital sign. It's as important as your pulse. When your walking slows down, it's often the first signal that your body is losing ground. Strengthening these muscles is how you defend that ground. Sit tall, press your back against the chair to keep yourself from cheating, and slowly lift one leg straight. Hold it for 2 seconds. Feel the tension, then lower it slowly. Do 10 to 15 on each side. If it feels easy, you can even add a tiny ankle weight. 1 or 2 pounds can make a massive difference because muscle responds to a steady load at any age. 9 o'clock to 12:30. Visual. Narrator standing behind a kitchen counter for support. Narrator. Now we move to the center of your mobility. Balance. Number 3. The supported calf raise. This is where circulation and balance meet. The National Institute on Aging reminds us that keeping these lower body muscles strong is the best way to keep your independence. Weak calves mean blood pools, but it also means your balance reactions get slower. An ordinary stumble that you used to catch easily can become a fall. Stand behind a sturdy chair or a kitchen counter, rise up slowly onto the balls of your feet. Pause for 2 or 3 seconds at the top. That pause is the most important part. It makes your muscles and your balance system fire together. Then take a full 3 seconds to come back down. Do this while your coffee is brewing. Over a few weeks, you'll likely find you feel more steady on your feet than you have in years. 12:30 to 15:30. Visual. A split screen showing the 10-second balance test. Narrator. This next one might surprise you. It's a test, but it's also a powerful tool. Number 2. The single leg stance hold. In 2022, a study published in the British Journal of Sports Medicine followed over 1,700 adults. They found that people who couldn't stand on one leg for just 10 seconds had an 84% higher risk of dying over the following years compared to those who could. It sounds dramatic, but it's a reflection of how well your internal systems are communicating. When you stand on one leg, your calf, ankle, hip, and core all have to stay contracted to keep you upright. That sustained squeeze keeps your second heart running the entire time, pushing blood up instead of letting it settle. Stand next to a wall or counter for safety. Lift one foot just an inch off the floor. Don't curl your toes. Just stand tall and breathe for 20 to 30 seconds. As you get better, try to rest your hand more and more lightly on the counter until you're just hovering above it. 15:30 to 18:30. Visual, close-up of the calf muscle contracting during a hold. Narrator. Finally, we reach the most powerful movement of all, the one used in vascular clinics worldwide. Number 1, the standing calf pump hold. This looks like the calf raise we did earlier, but it has one small difference: the hold. By rising up and staying there for 3 to 5 seconds, your calves act like pressure pumps that stay fully squeezed. This is what clears out the blood that has been stalling around your ankles for hours. In trials, people with poor circulation who did a program focused on this movement were able to walk significantly farther without pain, sometimes adding close to 100 meters to their total walking distance without any medication or machines. Rise up, hold at the very top for 5 seconds while breathing normally, then lower slowly. Do 10 repetitions. It's gentle, it's controlled, and it is incredibly effective at driving that blood back where it belongs. 18:30 to 2100. Visual, the narrator talking directly to the camera, warm and encouraging. Narrator. I want to tell you about a woman named Lorraine. She's a lot like many of the patients doctors see, 71 years old, sharp, still hosting her grandkids on Sundays, but she was quietly heartbroken because her daily mile-long walk wasn't stopping her ankles from swelling or her feet from being cold every night. She stopped obsessing over her step count and started doing these 5 movements for about 12 minutes a day. She did her ankle pumps in her chair in the morning, her calf raises while the coffee brewed, and her balance holds in the evening. Her circulation didn't turn into a 30-year-old's overnight, but within a few weeks, the bread dough ankles were gone. Her feet were warmer. But the thing she cared about most, she stopped feeling like she might tip over when she got up from the couch. She felt steady again. Before we end, I want to be very honest with you. These movements are for the slow, everyday issues of aging. If you ever have sudden, severe pain in one leg, or if a leg turns pale and cold out of nowhere, please don't do exercises. Call your doctor immediately. But for the rest of us, remember, your circulation is one of the few things where you actually get a real vote. These 15 minutes a day are how you cast it. Keep walking because walking is a beautiful thing, but don't let it leave a gap in your health. Wake up your second heart. Take care of your legs. They've carried you this far and they have so much further to go. Take good care of yourself. I'll see you in the next one, 2100. Visual, logo for the life outline fades in with a subscribe button.